Dear participants, we request everyone to quickly fill up the registration form. We'll be starting session in a minute. Good evening, one and all. We welcome you all to the International Webinar Series on Holistic Health, Well-being and Sustainable Development 2024, commemorating Azadi Ka Amrit Mahotsav, nation celebrating 76 years of independence and United Nations Sustainable Development Goals 2015 to 2030 as part of awareness and campaigns in collaboration with Sri Holistic Health Foundation India and Sri Research Institute Center for Art, Sciences and Wellbeing. Before we start our sessions, let's take the blessings of Almighty.
कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम्
With the blessings of Almighty, we shall continue with today's commemorations. Today is commemorated as International Day of Cooperatives on 6th July every year. This year, on July 6th, cooperatives around the world will celebrate the International Day of Cooperatives with the theme Cooperative Building a Better Future for All. Cooperatives will have opportunity to showcase their current and historical contributions to building a sustainable future, accelerating efforts to implement the Sustainable Development Goals SDGs by 2030. The theme aligns well with the objectives of the upcoming UN Summit of the Future, whose theme is Multilateral Solutions for a Better Tomorrow. For the 2024 Co-ops Day, cooperatives can showcase their high standards for inclusive and sustainable growth as stewards for protecting the environment and fighting climate change. Through democratic governance and shared ownership, cooperatives set an example for peace and stability, bringing people from diverse backgrounds together on equal terms and fostering understanding and respect. The 2023 UN Secretary General Report on Cooperation in Social Development acknowledged that cooperatives have a track record of promoting the economic and social development of all people, including marginalized groups. The day will build the momentum towards the 2025 International Year of Cooperatives, which was declared by the UN last year. When we look at the background of the cooperative movements, cooperatives have been acknowledged as associations and enterprises through which citizens can effectively improve their lives while contributing to the economic, social, cultural, and political advancement of their community and nation. The cooperative movement have been also recognized as a distinct and major stakeholder in both national and international affairs. Cooperatives often open membership model offers access to wealth creation and poverty elimination. This results from cooperative principle of members' economic participation. Members contribute equitably to and democratically control the capital of their cooperative because cooperatives are people-centered, not capital-centered. They do not perpetuate nor accelerate capital concentration, and they distribute wealth in a more fair way. Cooperatives also foster external equality as they are community-based. They are committed to the sustainable development of their communities, environmentally, socially, and economically. This commitment can be seen in their support for community activities, local sourcing of supplies to benefit the local economy, and in decision-making that considers the impact of their communities. Despite their local community focus, cooperatives also aspire to bring the benefits of their economic and social model to all people in the world. Globalization should be governed by a set of values such as those of the cooperative movement. Otherwise, it creates more inequality and access that render it unsustainable. The cooperative movement is highly democratic, locally autonomous, but internationally integrated, and a form of organization of associations and enterprises whereby citizens themselves rely on self-help and their objectives such as overcoming poverty, securing productive employment, and encouraging social integration. The International Cooperative Alliance unites, represents, and serves cooperatives worldwide. Founded in 1895, it is one of the oldest non-governmental organizations and one of the largest ones measured by the number of people represented. 1.2 billion cooperative members on the planet. The alliance works with global regional governments and organizations to create the legislative environments that allow cooperation to form and grow. What's in cooperatives, there are certain cooperative principles: voluntary and open membership, democratic member control, member economic participation, autonomy and independence, education, training and awareness, information, cooperation among cooperatives, concern for community. More than 12% of humanity is part of any three of the 3 million cooperatives on earth. The 300 largest cooperatives or mutuals report a total turnover of 2,409.41 billion USD, while providing the services and infrastructure society needs to thrive. Cooperatives contribute to the sustainable economic growth and stable quality employment, providing jobs or work opportunities to 280 million people across the globe, 10% of the world's employed population. The cooperative way of working is inspired by the cooperative values and principles, has the accomplishment of the Sustainable Development Goals as part of its DNA. 2024 celebration will be the 102nd International Cooperative Day and 30th UN International Day of Cooperatives. The International Cooperative Alliance was founded in London, England on 19th August 1895 during the first Cooperative Congress. In attendance were delegates from cooperatives from Argentina, Australia, Belgium, England, Denmark, France, Germany, Holland, India, Italy, Switzerland, Serbia, and the USA representatives established the International Cooperative Alliance, aims to provide information, define and defend the cooperative principles, and develop international trade. So the aim of this day celebration and commemoration is to increase awareness about cooperatives by highlighting how the United Nations share similar goals and objectives as the international cooperation movement. This day aims to acknowledge the contributions of cooperatives to resolve some of the major international issues that have drawn the attention of United Nations. The day also aims to strengthen the extent partnerships between the international cooperative movement and other outfits of social development. Cooperatives are associations and enterprises that allow people to improve their lives while contributing to economic, social, cultural, and political advancement. of their community and nation. For years, these cooperatives have been responsible for wealth creation and eliminating poverty. There are also often major stakeholders in national and international affairs. The members contribute equitably to and democratically control the wealth and profits of the cooperative association. Cooperatives tend to be people centered and not capital centered. Therefore, they tend to be more ethical and fair when it comes to accelerating capital concentration. Cooperatives also foster equality. Since they are community based, cooperatives are committed to the sustainable development of their communities. This include environmental, social, economical sustainability. Cooperatives also contribute to the community activities, local businesses, and decision making that impacts their communities. Although they are mostly focused on their local community, cooperatives aspire to share their economic and social success with everyone. They also aim to erase inequality and excess that are rampant under modern day capitalism. The cooperative movement is highly democratic and locally autonomous, but internationally integrated. The movement encourages citizens to be self-reliant and take responsibility for their economic, social, and environmental prosperity. Cooperatives have been successful in overcoming poverty, securing productive employment, and encouraging social integration. Today is also commemorated as International and also World Zoonosis Day, which is celebrated internationally. World Zoonosis Day is observed annually every year on July 6th. This day aims to shed light on diseases that originate in animals and that can be transmitted to humans. All these pandemics, including latest coronavirus, are all zoonotic diseases because we are interacting, we are consuming animals, and through animals and animal products, these zoonosis diseases are spreading and creating many pandemics. We have seen all the pandemics, endemics, epidemics were created by zoonosis only, either through interaction with them or through eating, consuming them, we are getting these diseases. So in a study by CDC, 60% of all existing infectious diseases are zoonotic, and at least 70% of emerging infectious diseases originate in animals. So on July 6, 1885, French biologist Louis Pasteur successfully administered the first rabies vaccine to a little boy bitten by a rabid dog. The vaccine not only prevented the child from getting rabies, it saved his life. Rabies is just one example of many zoonotic diseases. Avian influenza, Ebola, and the West Nile virus are some of the other examples that have been discovered over the years. Zoonotic pathogens can be viral, bacterial, or parasitic, can spread to the humans through direct contact or indirectly through food, water, or the environment. It may spread through an intermediary species. It does not just originate from wild animals like bats or monkeys. It can also come from pets and farm animals. The use of antibiotics in animals raised for food increases the potential for drug-resistant strains of zoonotic pathogens. That's why animals have an important role in zoonotic infections. As there are many types of zoonotic diseases, there are also many types of treatments, such as antibiotics. Some practices can help prevent the spread of foodborne diseases or foodborne zoonotic diseases, like safe guidelines for animal care in agriculture industry, having access to clean drinking water, and proper waste removal are effective ways to reduce the spread of diseases. Vaccinating household pets and maintaining proper hygiene, like washing your hands after close contact with animals, can also help. Protecting and managing the health of animals that live alongside humans is vital. When we prevent diseases in animals, we safeguard the health of people. The Mosaic, the first written account of rabies causing death in humans and dogs around 2300 BC. Ebola is discovered. It was named after Ebola River in Democratic Republic of Congo. The CDC estimates that the global death toll due to H1N1 influenza is more than 284,000. The swine flu outbreak in 2009. WHO declares the novel coronavirus outbreak as public health emergency of worldwide concern, the start of the COVID-19 pandemic on January 30, 2020. Researchers have found that bats carry the highest number of unknown pathogens that can infect humans. Currently, there are over 250 known zoonotic diseases, but many more may be waiting to be discovered. In a recent study from January to April 2021, rabies recorded the highest number of deaths at 88.3%. It is a misconception that indoor pets don't need rabies vaccinations. Make sure your cat or dog gets their shots. Always keep their vaccination schedule up to date for everyone's safety. If you or someone you know has a high risk of exposure to rabies, like veterinarians or animal handlers, make sure to take extra care. Protect yourself and them by getting a pre exposure rabies vaccination. Working at animal shelters can be challenging yet rewarding. Their staff always welcomes extra help, whether it's in the form of donations or volunteering to assist in the day to day routines or duties. Vaccinating animals protects them as well as people who spend time with them. It is 100% preventable disease. Asia and Africa has the most infections. Tens of thousands of victims die every year. Dogs are the main source for humans. They are the main source of rabies deaths, contributing up to 99% of all transmissions to humans. Washing a wound from the contact with a suspected rabid animal with soap and water may save a life. Thorough washing of a wound is important. Almost half of the victims are children of these bitten by suspected rabid animals. 40% are children under 15 years old. So pet owners don't just provide food and shelter for their animals, it's also their responsibility to keep the animal and everyone around it safe. And vaccination is one way to do that. Keep an eye on kids when they interact with animals. Be cautious. Don't assume that an animal is friendly in the wild or indoors. It's safe to touch. All over the world, lives and livelihoods have been lost or altered by the effects of different zoonotic diseases. So this day reminds us of them. So World Zoonosis Day also promotes online learning, supports governments to operationalize a One Health approach in countries. One Health is an approach in which multiple sectors communicate and work together to achieve better public health outcomes. The One Health approach is particularly relevant, includes the control of zoonosis diseases that can spread between animals and humans, such as avian flu, rabies, and Rift Valley fever. A One Health approach is key to the management of shared threats for future outbreaks and pandemics at the human animal environment interface. Three new courses are now available on the open WHO One Health channel, allowing learners from all around the globe to explore principles and best practices for One Health approach for zoonotic diseases. So I request everyone to enroll and complete on this World Zoonosis Day. The first course introduces the critical role of international frameworks to help human and animal health sectors bridge their work to meet shared goals for disease preparedness and response. Once learners understand the role of collaborative work in their country context, they can then explore the practical approaches set forth in the Tripartite Zoonosis Guide and its operational tools. The second course offering on One Health channel allows learners to explore and navigate the technical chapters of the Tripartite Zoonosis Guide in more depth, using country examples to propel their learning to the next level. And finally, a training for the implementation is available for those interested in using the Joint Risk Assessment Operational Tool to assess and manage zoonotic diseases hazards at national and subnational levels. Strengthening global health security at the human-animal interface. 75% of emerging pathogens are of zoonotic nature. Progress towards global health security requires a greater focus on the interface between humans and animals and a strong collaboration between the human health and the animal health sectors. WHO works together with international organizations and national institutions in charge of animal health to improve the rapid detection of emerging pathogens and to ensure coordination in rapid control measures. By strengthening the contribution of veterinary sector in implementation of IHR 2005, World Health Organization and its partners propose guidance, methods, and tools to jointly review synergies and gaps in the coordination between the two sectors and to support countries in the operationalization of a multi-sectorial One Health approach for global health security. International Health Regulations, IHR, Performance of Veterinary Services, PBS, National Bridging Workshops are three-day events facilitated by World Health Organization and the World Organization for Animal Health, bringing together 50 to 80% from participants from the public health and animal health services. The objective is to analyze and improve the collaboration between the two sectors in the prevention, detection, and response to zoonotic diseases and other health events at the animal-human interface. So, as we have seen, zoonosis, a zoonosis is any disease or infection that is naturally transmissible from vertebrate animals to humans. So, a zoonosis is a disease or is any disease or infection that is naturally transmissible from vertebrate animals to humans. There are over 200 known types of zoonosis. Zoonosis comprises a large percentage of new and existing diseases. In humans, some zoonoses, such as rabies, are 100% preventable through vaccination and other methods. A zoonosis is an infectious disease that has jumped from a non human animal to humans. Zoonotic pathogens may be bacterial, viral, or parasitic, or may involve unconventional agents and can spread to humans through direct contact or through food, water, or environment. They represent a major public health problem around the world due to our close relationship with animals in agriculture as companions and in natural environment and for consumption. Zoonosis can also cause disruptions in the production and trade of animal products for food and other uses. Zoonosis comprise a large percentage of all newly identified infectious disease, as well as many existing ones. Some diseases, such as HIV, began as zoonosis, but later mutated into human-only strains. Other zoonoses can cause recurring disease outbreaks, such as Ebola virus disease and salmonellosis. Still others, such as novel coronavirus that causes COVID-19, have the potential to cause global pandemics, as we have seen recently. So, how do we prevent and control? Prevention methods for zoonotic diseases differ from each pathogen. However, several practices are recognized as an effective in reducing risk at the community and personal levels. Safe and appropriate guidelines for animal care in the agriculture sector help to reduce the potential for foodborne zoonotic diseases, outbreaks through foods such as meat, eggs, dairy, or even some vegetables. Standards for the clean drinking water and waste removal, as well as protections for surface water in the natural environment, are also important and effective. Education campaigns to promote hand washing after contact with animals and other behavioral adjustments can reduce community spread of zoonotic diseases when they occur. Antimicrobial resistance is a complicating factor in the control of prevention of zoonosis. The use of antibiotics in animals raised for food is widespread and increases the potential for drug-resistant strains of zoonotic pathogens capable of spreading quickly in animal and human populations. Now, who is at risk? Zoonotic pathogens can spread to humans through any contact point with domestic agricultural or wild animals. Markets selling the meat or byproducts of wild animals are particularly at high risk due to large number of new or undocumented pathogens known to exist in some wild animal populations. Agricultural workers in areas with a high use of antibiotics for farm animals may be at increased risk of pathogens resistant to current antimicrobial drugs. People living adjacent to wilderness areas or in semi-urban areas with higher number of wild animals are at risk of disease from animals such as rats, foxes, and raccoons. Urbanization and the destruction of natural habitats increase the risk of zoonotic diseases. By increasing contact between humans and wild animals. So World Health Organization works with national governments, academia, non-governmental and philanthropic organizations, and regional and international partners to prevent and manage zoonotic threats and their public health, social and economic impacts. These efforts include fostering cross-sectional collaboration at the human-animal environment interface among the different relevant sectors As part of One Health approach, the World Health Organization collaborates with the Food and Agriculture Organization of the United Nations, FAO, and the World Organization for Animal Health, OIE, on global early warning system for major animal diseases. This joint system builds on added value of combining and coordinating alert mechanisms of three agencies to assist in early warning, prevention, and control of animal diseases, threats including zoonosis through data sharing and risk assessment. The tripartite zoonosis guide TZG, in short, has been developed jointly by FAO, WHO, and WOAH to support countries in taking a multi-sectorial One Health approach to address zoonotic diseases. It provides principles, best practices in the form of universal options to assist countries in achieving sustainable and functional collaboration at the human animal environment interface. Taking a multi-sectorial One Health approach is necessary to address complex health threats at the human animal environment interface, such as rabies, zoonotic influenza, anthrax, and the Rift Valley fever. Such zoonotic diseases continue to have major impacts on health, livelihood, and economies and cannot be effectively addressed by one sector alone. By using the TZG and its associated professional tools, countries can build something, strengthen their other capacities. By using the TZJ and its associated operational tools, countries can build and strengthen their national capacities in multi-sectorial One Health coordination, mapping country context, planning and preparedness, surveillance and information sharing, investigation and response, joint risk assessment, risk communication, workforce development. By working together and collaboratively, our global health systems are improved in a sustainable way, ensuring the climate prevention of the A multi-sectorial One Health approach is necessary to address complex health threats at the human-animal environment interface. Since 2017, FAO, WHO, WAOH have developed the Joint Risk Assessment Operational 2 and Independence 2 soon started. So with this, we shall end today's commemorations. Thank you, everyone. Quickly fill up the feedback form, which has been shared in the form of polls. See you all tomorrow at the same time with the same joining link. Take care. Good night.